So for the doctors listening, and actually I did a podcast on this with ACT around what we need to do within our practice to provide an environment in which hygienists can really thrive in developing a periodontal protocol. There has to be intention around it. There has to be structure. We have to be able to talk and agree upon, or I should say align. We don't necessarily have to agree, but we at least need to align on what healthy is in our practice and what it's not, and what do we do when we see those things. And so there's a lot of opportunity for practice owners and doctors also to be involved in those conversations so that your overarching philosophy is built into that. It's just really, really important to know that there's protocols in place to help patients. Patients know more and more now from what they're reading and seeing on social media and in the news, how important oral health is. And so if they're looking for someone to take that seriously, then we have to be those people for them. And it's really important to also then know how to measure if the protocol that we put in place is successful.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host.
Welcome, everyone. Super excited to have you today. It is a beautiful week. Now, first off, before I jump into our guest, like always, if you're a first-time listener, super excited to have you on. I want to give a shout out to Dental Intelligence. They sponsor this podcast week after week, and we're grateful for the content that we're able to get out from their sponsorship. They always are offering a $50 gift card to come and check out a demo of what they're doing. Now, there's been some cool stuff that's been released lately. There is insurance claims management. There is automated insurance verification checks that you can do. There is also, the most recent thing is a great, cool new tool called Scorecards that you definitely want to check out. It basically takes like all the data mining of Dental Intelligence, your practice management software, and allows you to create one simple view where you can see all the metrics you want to see, whether that's a hygiene scorecard or a dentist scorecard or a new patient scorecard, whatever it is. Super cool. If you haven't checked it out, definitely get with our team and check out a demo of Dental Intelligence. The last thing I'll ask, if you're a new listener or a return listener, it helps us so much if you rate and review the podcast. So whether you're listening on iTunes or Spotify or on YouTube watching the videos, please go ahead and rate and review. And we are so grateful for all of our listeners that come back time and time again. Now, with all of that out of the way, I want to introduce you guys to our guest today, Miranda Beeson. She is amazing. She has a well-rounded view of dentistry. When I met her, I was so impressed with her background. So she has been a hygienist for over 20 years, which is cool in and of itself. My wife's a hygienist. I love hygienists. I think that they're the coolest people. And she not only worked clinically in the back office, but she made a move, just so you understand like her perspective. She made a move to the front office and helped manage an oral surgeon surgical center, and she was a surgical liaison. And so she started to get this like perspective of how does the business run. That business grew until they had 32 team members. She's even done a stint at Sonicare before stepping into doing more consulting, and now works at ACT Dental. And she has this perspective on dentistry that I love. Not only that, she's a student of human behavior and psychology. She has multiple different what's the word I'm looking for? Certifications. The one of which that I was familiar with is DISC. Now there's a couple others. Miranda, what were the other two that you had mentioned?
Oh, driving forces, what motivates our behavior, and also emotional intelligence.
Yeah, so she's like, so just so you know, she's got a total brain on her shoulders, and I am super excited to learn from her today. So Miranda, welcome to the show. Anything you want to add? What are you like? What are you excited about in dentistry right now? And then we'll kind of jump in today. Sure. Also, we'll frame this for everyone listening. We're going to get into perio. I want to dive in and have a conversation. It's the end of the year. We're thinking about our 2024 goals. And I think it's a wonderful time to start thinking okay, what do we want to do as a hygiene team? So this one's definitely hygiene oriented is where we're going to go. But anyway, tell us what you're excited about, Miranda, and I'll shut my mouth for a minute.
Thanks so much for having me. I'm really grateful for the opportunity to be here. The more people we can communicate with and impact in the dental community, the better. I am a total tooth nerd. I absolutely love dental people are my people. Hygienists are my people. So anytime I get an opportunity to be with like-minded individuals, it really brings me joy. What am I most excited about in dentistry? It's so hard to pick one thing. I absolutely love right now the role that I'm in. Like you said, I've had a lot of opportunities throughout my career and feel very blessed by those opportunities. And currently my role at Act Dental is just really exciting. I'm a lead practice coach and love working with teams and helping to develop and grow teams, not only in culture, but in the business structure and profitability as well. And I have a new position as director of education. So being able to get in front of the room and share my experience and things that I've learned over the years from other really brilliant minds, and just continuing to grow other dental professionals. Dentistry has changed a lot in my 20 years of being in dentistry. My uncle was a dentist and my dentist when I was growing up, which is what inspired me to do. When I think back to what it was like in his office when I was a kiddo, it's really changed since then. So I just love watching the innovation that happens in dentistry. I love that we have had such a shift into culture and how important that is in the practice now. And obviously anything that has to do with digital dentistry and the implant world really excites me too. There's just so many things to be excited about in this profession right now.
It is a big, beautiful world. And the future of dentistry is bright. Like if I can bring the energy to people, like, man, it's a cool world that we live in, and really cool tech in healthcare, great tech in dentistry. And like just great stuff's happening. So anyway, I want to jump in. Miranda, we were talking kind of in prep, and there are a couple of beliefs that I wanted to frame about this conversation, because if we start talking about perio, sometimes it can be one of those things where the hygiene department's like, you know what, like, don't tell me how to operate, or like, no, I'm not doing anything like wrong. I don't need to like up my perio diagnosis, or I don't want to do more fluoride, or I don't want to do sealants, or I don't have enough time. Like there's a lot of kickback that can happen, and most everything I hear, there's some good validity to it, right? Like I love if a clinician has a fear of like overdiagnosing. Like, I don't want to do that. Great, perfect. I don't want you to do that either. I don't think anyone does. And so there's a couple of beliefs. The first one I wanted you to share a little bit more on is the way that I wrote it was that patients deserve to know the best possible options for their clinical care. Like what is the best possible option? So I wanted you to like share a little bit about that belief.
Absolutely. I think it's so important. And I really think it's our responsibility. We go back to the oath we took when we became hygienists, and we can relate this to dentists or any providers in the office really, but it's just our responsibility to be providing the best possible options and then helping to guide and answer questions for that patient so that they can make really educated, informed decisions on their own health. So I just think that sometimes we miss the mark when we're trying to be nice. I have a phrase I say often of nice isn't always being nice. We think we're being nice, but ultimately, are we, if we're allowing their disease to progress, or we're putting them in a position where possibly their systemic health is now compromised? And so I really do believe that it's an opportunity that we're offering when we present treatment or findings that we're seeing in the chair for them to have an opportunity to be healthier than they even knew they needed to be. Oftentimes they're relying on us solely for the truth about what's happening in their mouth and in their body. And if we're not being honest and forthright and sharing with them what those findings are and the different possible ways that they can navigate those findings, then are we really doing right by them is kind of where I'm at with that. So I just think it's our responsibility, and they're coming to us for that. Yes, we want to I love my patients, and we hug and we cry. And I know your kids and your grandkids and the trip you went on, and all of that is so important to me as a hygienist as well. But I don't think there's anything that's more important than honoring that responsibility that we have to make sure that they know what their health has in store for them and what the options are.
Yeah, I love that. Thank you. And for listeners too, the reason why this conversation comes up, I think often is, so I'll share one stat. So Dental Intelligence looks at the performance of 10,000 practices, and the average general practice is, when you look at the hygiene perio percentage. So we're looking at patients that are age 30 and older, and we're looking to see if we're billing out periodontal codes on the patient's ledger in that calendar year. And that perio percentage is 16%. Let me look at last year. Yeah, 16%. And then it was 13% in 2021. So we made like a little bit of improvement. We went from 13% on average to 16%. But when you look at ADA stats, and this is where like the question becomes like, okay, what's true? Is it true that only 16% of adults have some form of periodontal disease that should be addressed? Or is the ADA right and it's like somewhere in that like 40 to 50%? Or is it somewhere in the middle? I will share this, that the top 10% and top 10, I guess maybe it's not like, it makes it sound like it's the best performers. And I think, I don't know, with some of these clinical ones, I don't know if that's the right way to phrase it, but the practices that are doing more perio, I should say it that way, the average of those practices is 34% of their patients who are age 30 and over are in building out some type of periodontal code. So I actually mentioned Miranda.
Can I make a mention on that real quick?
Please, like talk through that a little bit. I was hoping you would.
Yeah. So it's funny that you say it that way, because as a practice coach, that is something that we embark upon a lot. Mm-hmm. It is, are we just trying to make more money for the practice by prescribing more perio? No.
Yeah, when great. That is a great concern to bring out and hit right out of the gates.
It's so common. It's so common. And I, like you said earlier, when someone's being concerned about over treatment planning or being aggressive, a word that people use quite often, I'm with you. I want you to be as ethical as you can possibly be.
Yes.
And so I would pose the question of, are we being ethical if we're not creating that opportunity for our patients to achieve health? So I agree with you in that if you look at statistics through the ADA, we're somewhere in that 40 to 50% range. There's some research when you dig in as we get older, it's even into the 60s and 70s. And so if our benchmark in our practice is, and some of my teams are well above 16, and I have some teams that are well below 16%. And so that's another piece, is like, you're just where you are and that's where you're starting, and that's okay.
Yes.
But to me, looking at that number and that metric as a hygienist isn't to say, great, that means our practice produced this much more. That's an awesome benefit to the practice and the profitability of the practice and potentially my income in the future as well. But what I see that number is a measurement of the number of people whose lives we're positively affecting. And I think that's the best way for a hygienist to reference KPIs, numbers, KPIs, key performance indicators, can be scary for clinicians because we're about caring for people. And so when we turn it into a data point, it can feel cold. And I think if we can shift our mindset into looking at those data points as not dollars necessarily, though that's very important, I won't ever leave that out, but looking at it as how many more people are healthier tomorrow from what I diagnosed today. And with what we know now about periodontal disease and the effects on our whole body health, I just think it's nothing but good news when that number is going up and more people are reaching their potential of health.
Yeah, I 100% agree with that. And the last thing I'll say, and this is that like second belief, is that investments in self are always worth it. It's something that I believe in. When my wife and I first got married, we kind of like had a discussion around like our finances, like what are we willing to spend on and what are we not willing to spend on, and like what always has a green light and what needs to like be like a check together. And one of the things that we decided early on, like very early on, was that if we as an individual wanted to make an investment in ourselves, and that's like schooling, or like at one point I did adult ortho because like my bite was bad, and like anything that we want to do to invest in self, or like races or like exercise things, like whatever our goals are, and we want to invest in ourselves, or therapy, that we are going to open our pocketbook and spend money there because we're trying to have like a long, wonderful, healthy life. And so if we as clinicians can believe that, right, that investments in self are always worth it and can help like radiate that belief into our patient base, that's also going to be a healthy thing. So as we come into these clinical conversations, I think that's one other key belief that I would just share as we come into this conversation and jump deeper into like perio and hygiene.
Yeah, I agree with you completely. And I think to top that off is ask your patients versus allowing your own bias or assumptions to be projected into the treatment that you're recommending, or I don't want to upset with them with this, or I don't know if they're going to be able to afford periodontal treatment. Any bias that we put out there is our own, and we're then relinquishing the rights for them to have control over their own health and their own decisions. And so to me, it's just asking open-ended questions. I love the co-discovery process and having the patient be a very active participant. I think the more I use this phrase that I don't want my patients to feel like an information receptacle, like they're just a bin that I'm dumping information into. I want to make sure the information that I'm sharing with my patients fits their agenda. And like you just said, you have values and you have things that you've agreed are goals for your own self. Everyone does, whether they've said them out loud or written them down or not. The only way we know that about our patients is if we ask them open-ended questions to learn more. So I love using the periodontal chart and having visuals. I think it's really important before we even do the assessment to have a conversation about what we're listening for, what you're feeling for. If you notice this, that might mean there's active infection there, versus the patient laying there as a passive participant, like, they're stabbing me. If they're actively involved in that process, when we sit that patient up and we turn the chart around and we have an image or an x-ray available to put into that conversation, and then we follow it up with open-ended questions to learn more about if they are concerned about this, what concerns do they have, and build it into their life, then it's going to resonate more with them and they're going to want that for themselves versus us trying to tell people they need something that they don't even really understand.
Yeah, I love that. Now tell me, let's dive in deeper. Maybe you set the stage a little bit. Why is perio important to an office and to the patient? And then maybe jump into like how, and this is, if it's a doctor listening, maybe the question is like, how can I get my team to diagnose perio and get it accepted? And if it's a hygienist, maybe the question's like a little softer, like, hey, like I agree, like I want to do better at my perio diagnosis and do the best by the patients. Like talk me practically through how that works. So let's start with like, why is it important? And then dive into some like practical stuff. That's
sure.
Cool.
Do you have like 4 hours? No, I'm just
right.
I'm just teasing. It's really important for the doctors listening. And actually I did a podcast on this with ACT around what we need to do within our practice to provide an environment in which hygienists can really thrive in developing a periodontal protocol. There has to be intention around it. There has to be structure. We have to be able to talk and agree upon, or I should say align. We don't necessarily have to agree, but we at least need to align on what healthy is in our practice and what it's not, and what do we do when we see those things. And so there's a lot of opportunity for practice owners and doctors also to be involved in those conversations so that your overarching philosophy is built into that. It's just really, really important to know that there's protocols in place to help patients. Patients know more and more now from what they're reading and seeing on social media and in the news, how important oral health is. And so if they're looking for someone to take that seriously, then we have to be those people for them. And it's really important to also then know how to measure if the protocol that we put in place is successful, because no matter what continuing education we go to or send our team to, no matter what we set up systematically, how much time we spend on it and invest in it, if we aren't measuring to know if we're being successful in what we're putting into place, then it's really all for naught in the end. So that's what I love about Dental Intel when I'm working with clients, and I do have so many that do. It's so easy. The information just right at our fingertips, and the hygienists have access to it. The practice owner has, the coach, we all have access to that information, and we can reflect on it on a regular basis.
And I would ask, I'll just follow up, like do you have like specific metrics in perio where like, hey, like there are so many numbers that you can look at in any business, especially in a dental practice, and we can get like overly nitty gritty sometimes. Do you have a few simple metrics that you're like, hey, these are the ones I like to watch in hygiene to know if what we're doing is working and if what we're trying is improving or not?
Sure do. I have really top 3 that I work on with practices and hygiene departments specifically. The first one is the periodontal visit percentage. You hinted to that just a little bit ago. And that's that percentage of patients that are seen by hygiene in a given period of time that were periodontal patients. And so that's your full mouth debridement code. Your gingivitis code is built into that too now, the 4346. And then our periodontal maintenance and periodontal scaling, whether it be localized or generalized. And the implantitis code D6081, for those of you who are code nerds like me, is also built into that percentage. And so that's telling us that how many of the patients that we're seeing, what percentage of that patient base with hygiene within a given period of time were seen for periodontal services. And most people are starting, like you said, I know practices that start at 1%, and
I see it all the time.
Prophy exam.
It's surprising that the average is 16, because I feel like I see like between like 3 and 7, like really often.
I
as a
would
starting
probably
place?
agree with you. Somewhere under 10% is what I
Yeah.
see the most. Certainly when I get started with coaching clients or I'm,
Hmm.
going into an office for the first time. And what I like to tell those teams is that's okay. That's okay. That's just
Yeah.
where you are. There's no shame in that. Now that you know better, we're going to do better. And so small increments as you grow in your periodontal protocols, as you start to get more comfortable and more confident in the conversations with your patients, as you start to see that acceptance improve, your administrative team starts to support those protocols as well. That number will grow over time and it's going to happen incrementally. And you just have to celebrate the small wins along the way. Like you said, I like to set a benchmark that's in around 35%. And I'm not going to go from 2% to 35% with a team, though. I think you have to be really smart and realistic about the goals that you're setting for yourself.
Hmm.
It does take time to get there for sure. And then from there, there's two others that I think work hand in hand. And that's the periodontal diagnostic percentage, which
Hmm.
is what percentage of patients that were seen for hygiene in an exam and were diagnosed with new periodontal treatment. So again, if the same codes I mentioned before are entered into a treatment plan today, they're going to be measured into that diagnostic percentage. And so when we're implementing a new periodontal protocol in the office, it's going to help to gauge the efficacy of
Hmm.
making the diagnosis. How
Which
aligned are we?
which I love that one because that's like the one that a clinician has like total control over, right? Like, okay, I'm identifying it, I'm adding a treatment plan, and the assumption is obviously it's getting presented as well. And, I tell people all the time, like the power of life and helping people to do something better is in invitation. Like that's the thing that we can control. And so let's like invite whenever we see an opportunity to make improvement.
Yes. And if there's more than one hygiene practitioner in your office, you can also work together. And if someone has a really strong diagnostic percentage that's growing and they're seeing a lot of success in the health of their patients, and you want that health for your patients, you guys can work together to say, hey, I see things are really growing for you here. This is what I struggle with. I struggle when they give me pushback. What do you say when they say this? And you can work together as a team. But without that data, it's hard to know who to go to. But if I can
Yeah.
see clearly that Susie does a really great job with that, maybe she and I could have lunch together and we could talk about what strategies work for her that aren't working for me. But the other piece of this that's really, really important, because that number alone doesn't tell the whole story, is
Mhm.
the periodontal acceptance percentage. And that's the percentage of patients that are diagnosed with periodontal disease of some kind. That treatment plan went in and we've diagnosed it. And then what portion of those patients that were diagnosed actually accepted treatment and scheduled that day for services moving forward from that treatment plan. And so I like to say that neither number alone is great, because if you have
Yeah.
one patient
Sure.
that's diagnosed and you're at 100%, you're going to say like, woohoo, we're at 100% acceptance. And it
Yeah.
was one patient out of 50.
Uh-huh.
So we do need to see both pieces to gauge if our protocol is really effectively working.
Yeah, I love that. I love that string. And if you're a doctor listening too, I think that same clinical workflow obviously works for you as well. But I think those are three phenomenal numbers for a hygienist to look at, and they're just so helpful, right? Like, okay, like am I identifying it, and then is my presentation effective or not on that case acceptance side? Is it getting to the action that I'm hoping the patient will take, which is
Yeah. And with both
great.
of those, your visit percentage will grow. But we have to
Mhm.
start with diagnosing. And I'll say the one tip I have is the most important thing you can do. The easiest thing that your team can start with is to all your hygiene team, the doctors, sit down and decide, what does a healthy patient look like?
Mhm.
And then once you've made a very clear alignment around what healthy looks like, every patient that's in your chair, now you have that bar to measure that against. And if it's not that, it's something else. What is it? And
Mhm.
so the easiest thing is just aligning first on what healthy looks like. And one more thing that you mentioned was time is a big
Yeah.
pushback. And a
Uh-huh.
lot of hygienists will say, we need more time in our schedule. But, I have 60 minutes, but I feel like I need 70. And I'll ask them, have you identified health yet? Well, yes, but what about those patients that are overdue and the patients that like they have so much calculus and I have to catch them up? And I'm like,
Mhm.
do you have to catch them up, or do they have active disease that really we should be stopping and evaluating and possibly treating something else for, and not
Mhm.
like overworking ourselves for this prophy? So yeah, I think that time sometimes is us overgiving of ourselves in an
Mhm.
appointment versus stepping back and really making the accurate diagnosis chairside.
Yeah, in fact, I'll make this comment too. I think, one of the things that I think it's always a good call to remember when we're talking about like bloody prophies or like extra difficult prophies.
Yes.
Like, just remember that that clinical records, keeping accurate clinical records is so important, even just from a liability sake, right? Like if I see periodontal disease, but I'm trying to like hook the patient up by doing a bloody prophy and just billing out that.
Yep.
And so that's what the clinical record says I was seeing. Then, but then that periodontal disease turns into something worse, then that's not a position I want to be in either, right? So I think making sure there's always like very accurate clinical records of what am I seeing is so important. So that's another, I think, mindset to just like adopt. Like, okay, I want to make sure I'm always keeping a record of what's actually happening, not like I'm trying to hook someone up record of what's happening. So
right. And what Kirk who owns Act Dental, he always says, are we doing, when we do those prophies that are actually perio, we're serving champagne, but we're charging for water.
That's such a good comparison.
And then what I say is, like, as hygienists, we are literally breaking our bodies. That's a whole nother conversation. You
For
probably
real.
hear your wife's a
Hands,
hygienist.
back, neck, straining your eyes, all of it.
All of it.
Yes.
And ultimately, we could probably be making it a little bit easier on ourselves and providing those best possible options for our patient to make the decision for themselves about what they want to do with their health.
Well, any last tips before I ask like the final question? I mean, time has just flown on this.
I would say the two big tips and takeaways, if nothing else, is to define health. Start there, have that as a bar. It's really, really easy once you know what that looks like to identify when something doesn't look like that and that we need to be doing something else. And then the other piece that I'm just so passionate about is customizing it and really building value with your patient. Think about who that person is on the other side of the conversation. How do they like to receive information? What's important to them? What other tools in your office can you use visually to help tell the story so that they're very much an active participant in your treatment planning and diagnosing? I always say, without value, there's only price. And so until we can really make sure that we're value building and they understand the investment, like you said, that they're making in themselves, it will just feel like a price tag and another procedure on a line item on a treatment plan. But if we can really take the time to get to know them and what they want and meet them there, you're going to have a lot more success. And in the end, more of your patients who you consider friends will be healthier.
That is such good advice. Now, the last question that we ask every guest is, Miranda, what does growth in dentistry mean to you? And then we'll call it a wrap.
Such a good question on the spot. I'll go two ways. I'll speak to the profession and then to hygiene, since we're talking hygiene today. So as a profession, I think growth in the profession that I really am enjoying seeing is, again, that culture piece, not only for our teams, so I think that's very deserved. I also love that culturally we're creating a more patient-driven experience in our offices. It is becoming a much more dedicated to the patient experience, the person, and the process. And we have a growing number of private owned offices where I think we were skewing a little bit there for a while. Not that I have anything against those that aren't. I've worked in both. But I do love that the time that like fee-for-service practices allow with their patients, anything that we can do to customize the patient experience, I feel like there's a lot of change headed in that direction for dentistry, which I love. As far as hygiene goes, when I think of growth, I think CE. And so I always make it a point to put a little PSA out there to all my fellow hygienists. Don't wait for your doctor to invest in your continuing education. This is your career. This is your life. It's your passion. If you want to be fulfilled and you want to grow in your career and in your profession, really dig into the things that interest you, that feed your soul, that fill you up, the things that you see on a daily basis with your patients that you wish you could do more with, and then go find it. There's so much out there. Podcasts like this, continuing education programs in person, virtual webinars. There's just so many opportunities to learn. And I just always encourage hygienists. I hear very often well, my dentist doesn't send me to CE, but like, this is you. It's about you. You might not even be there forever. So just invest in yourself, grow yourself professionally. And the fulfillment that this career can bring is immense when you do that. Investing in yourself, it's full circle.
I love it. That's so good. Great advice. Great response. Miranda, it has been a treat having you on with us today. Once again, to the listeners, this has been a Growth in Dentistry podcast. Thank you much for joining. I always give a nice shout at the end of the marketing team who put so much effort to produce this thing. Grateful for all the work that they do. Grateful for all the work that the listeners do to take care of patients and to help drive this industry forward. Thanks again, everyone, and keep growing.